Hi, this is Dr. Brian Katt, and I'm going to go over some pre- and post-operative instructions. Prior to surgery, certain medications, such as blood thinners, are usually stopped. This will be coordinated with your medical doctor. Please remind your surgeon and staff that you are taking a blood thinner. Many of your other medicines can be taken the morning of surgery with a small sip of water. The surgery center staff will confirm which medicines should be taken. The day before surgery, the surgical facility will call you the day before in the afternoon and tell you what time to arrive to the facility. Prior to arrival, nothing to eat or drink after midnight if surgery involves any anesthesia other than local only. If you are having local only, you may eat as tolerated. Normally scheduled medications are allowed with small sips of water. On the day of surgery, make sure to shower and wash the surgical area well with soap and water to decrease the chance of infection. Wear loose-fitting clothing to the surgery center. After checking in, you will change into a gown. You will receive an IV if undergoing anesthesia. You may receive a nerve block in the pre-op area if this is part of your procedure. You may also receive local anesthetic in the preoperative area. In the operating room, there will be several personnel. In addition to the surgeon, there will be nurses, surgical techs, assisting doctors, and the anesthesia team. You will be sedated if you are having anesthesia once you come into the operating room. Your arm will be cleaned with an antiseptic wash. Drapes will be placed around you. After surgery, you will go to the recovery room. If you were asleep for the surgery and had anesthesia, you'll be in the recovery room for at least 45 minutes. If you did not have anesthesia, you will be able to leave almost immediately. Your family will receive a phone call or a direct visit from the surgeon once you are taken to the recovery room. Your family can wait for instructions from the nursing staff as to where to meet you after the surgery. In some cases, your surgical dressing can be removed 2 to 4 days after surgery. Your surgeon will discuss this with you. After the dressing is removed, the incision and sutures can get wet. However, do not soak the incision and avoid hot tubs and dishwater. Cover the incision with a dry dressing or Band-Aid after the initial dressing is removed. Please do not apply any creams or ointments to the incision at this time. No neosporin, bacitracin, or peroxide. For certain procedures, the dressing is kept on and dry until the first follow-up visit, which will be 10 to 14 days after surgery. When bathing or showering, place your limb in a plastic bag with a rubber band above such in order to keep the dressing dry. For certain surgeries, you may have a clear plastic dressing adhere to your skin. It's okay to shower directly over this dressing when allowed by your physician. Post-operative care. Elevation is helpful. This means elevating above the level of the heart when possible. Ice is also helpful. Ice should be 20 minutes on, 20 minutes off, several times a day for the first 48 hours after your procedure. If any fingers are exposed from your splint or dressing, you should move them freely. Do not lift anything unless allowed by your physician. What to expect after surgery. Numbness is normal. Local anesthetic is placed during the surgery, making different parts of the limb feel numb. In some cases, this feeling will last 12 to 48 hours. Swelling is normal. Keep the limb elevated. If the swelling becomes excessive, you can loosen the outer wrapping, but please contact the office if you do such. Bleeding is normal. Spotting of blood is to be expected. Reinforce the dressing if needed. If the bleeding becomes excessive, please contact the office. You may continue and resume your normal medications after surgery. Antibiotics will usually be given to you in your IV just before surgery and are typically not needed after the procedure. Prescription pain medication may be given with instructions to take as needed for pain. Some pain after the surgery is to be expected. Please check with your physician when blood thinners can be restarted. There are numerous painkillers that can be given. Painkillers also can be called opioids. Percocet or Roxicet is oxycodone plus Tylenol. Vicodin, also called Norco, is hydrocodone and Tylenol. Tylenol number 3 contains codeine and Tylenol, and Ultram is also called tramadol. Opioids are effective and commonly given after surgeries. However, they have less desirable qualities as well. Nausea and vomiting, constipation, itchiness, and addiction can all occur. There has been a growing opioid use, addiction, and abuse in America over the past 15 years. Some opioid epidemic facts. Americans represent 5% of the world's population, but consume 80% of the world's opioids. Opioid overdose is the leading cause of accidental death in young people, now surpassing car accidents. One of the main starts of opioid abuse is prescription opioids received after medical care, such as surgeries. There are some opioid use recommendations. Recommendation number 1. Medications such as Tylenol, Advil, and Motrin should be considered your primary pain medicine and should be used before using your opioid prescription pills. Opioid pills should be considered secondary medication and only used for spikes in pain. Apply ice to painful areas and elevate the limb. Recommendation number 2. You will be prescribed only a few opioid pills. Most patients will not need more than 10 opioid pills after surgery. Although it's uncommon to need a refill, if you do need a refill, please call the office. Recommendation number 3. Based on our experience and research, patients should not need to be taking prescribed opioids beyond 2 to 3 days after surgery. Recommendation number 4. Do not mix your opioids with other prescription pain medications. It is, however, safe to combine with Tylenol, Motrin, Advil. Do not drink alcohol while you are taking your opioids. Do not drive a car or operate heavy machinery while taking opioids. Reactions are common with opioids, including sleepiness, nausea, constipation, and itchiness. If you have a reaction after taking your opioids, stop taking them. If you develop constipation, take an over-the-counter stool softener such as Colace and stay hydrated. Unless otherwise stated, we would like to see you back in the office 9 to 14 days after the procedure for a checkup and removal of any sutures if necessary. Ideally, you should have your post-operative appointment already set up prior to your surgery. Contact information for the office will be provided with your discharge paperwork. At your first follow-up appointment after surgery, you should expect to review your surgery and imaging, review your restrictions, have your sutures removed, begin physical therapy when necessary. Please call the office if you experience increasing pain despite opioid medications, drainage from the wound for multiple days, increasing redness at the surgery site, a fever greater than 101.4 that does not go down with Tylenol. Thank you for entrusting your care with us.